Welcome back. This is the part of the show where we take in your questions and put those to a doctor. The number is 8377088377. You can speak to a doctor, and we've got two great ones today. GC Khilnani is Chairman, PSRI Institute of Pulmonary, Critical Care and Sleep Medicine, and also Dr. Suranjit Chatterjee, who's Head of Internal Medicine at Apollo Hospital. I'd like to thank both of you very much for joining us. Now, this is the part of the show when we try and answer questions on the COVID-19 outbreak. We've got our first caller. Go ahead with your question. Nilanjana, go ahead with your question.
Yeah, this is Niranjana from Bangalore. So I want to ask that my mother is working in essential services and she needs to go for work. But at home, I have my dad who is 60 plus and grandparents who are 90 plus. So what precautions to be taken when she is back to home?
She has to go for essential services, right? She's part of that. Is that what you said?
Yeah.
Okay. So, Dr. Khilnani, would you like to take that question? That when a person who has to go for essential services returns home and they live in a house with senior citizens, what precautions should they take?
That's a very important question. The reason is that mortality in patients who are 60 years and above is exceedingly high in patients who are affected by corona infection. So this question is very important, and I think for Nilanjana, my advice would be, as you come home, before you see or touch your grandparents or even see them, you shed off all your clothes and go for a bath with soap and water and put your clothes into the hot water, and that will do the trick. The reason for saying that one of the major mode of transmission is fomites, that is non-living things. There is always a potential for your clothes and your hands being contaminated, and also only yesterday the report has come that there is airborne transmission also. The fact that we were telling that, if you are 1 meter away from another person, you won't transmit is fictitious and doesn't hold any truth anymore. Since the airborne transmission is there, you quickly go to your washroom and bathroom and have a bath and come out and change the clothes, and then you are clean.
All right. Thank you so much, sir, for answering that question. We've got Sudhir with a phone call on the phone line now. Go ahead, Sudhir, with your question.
Thank you very much, sir. Good evening, sir. Sir, my question is, how do we differentiate between a coronavirus symptom and a normal flu symptom?
Okay. Dr. Khilnani, how do you differentiate between a flu and coronavirus?
Absolutely, there's no way that you can differentiate between coronavirus infection, because the symptoms of coronavirus symptoms could be starting from just bit of body ache or the sore throat and sneezing and cough. And the New England Journal study, which came on 28th of February, which said that 43% of the patients do not have fever to start with. So fever is not sacrosanct for corona. That should be understood, and even till the whole illness, only 83% had fever. So none of the symptoms is sacrosanct for coronavirus. So summarizing it, it's impossible to discriminate between the normal flu and the corona. So one has to go into the travel history and the contact history, and that's where we are today.
All right. Do we have Jogesh from Hyderabad on the phone line? No, we don't have Jogesh from Hyderabad. All right, we should also be joined in a few moments by Dr. Suranjit Chatterjee, Head of Internal Medicine at Apollo Hospital. But Dr. Khilnani, let me ask you one more question myself. What exactly are people supposed to do when they have to dispose of their own garbage and they necessarily have to step out of their homes? Because garbage disposal services are not very often easily possible. You have to take your own garbage and you have to take it to a garbage bin, which might be a short distance away, a public garbage bin on the road. And then are you not potentially exposed to more germs over there?
No, not at all. Not at all. I mean, as long as your garbage bag is properly tied and sealed, of course you will take it with your own hand. So what you are supposed to do, I know some people have asked this question also, when they come back home, they have to wash their hands thoroughly. Now, that washing, I would like to reiterate, people just wash it for 5 seconds and think that they have done a proper washing, and it's available on net, but you have to actually use a soap and rub it like this, rub it like this, rub it like this, do like this, do like this, and ultimately do like this, and drain your hands, and ultimately don't wipe it with your towel. Just soak it, dry it with the tissue paper, and with the tissue paper, put off your tap and dispose the tissue paper. If you have done that, there's nothing to worry.
All right. Manu from Gurgaon joins us on the phone line. Manu, go ahead with your question.
Yeah, hello doctor. I need to get a blood test done, an LFT, and for that I'm calling the person to get the samples at my home. So is it safe right now, and what precautions should I take?
Dr. Chatterjee, this gentleman has a blood test to take, so he's called a medical professional to come to take the test from their house. Is there any precaution that they need to take? Dr. Chatterjee, can you hear me? I think we've lost that line with him. We'll try and get it back. But Dr. Khilnani, would you like to take that question?
Yeah, that's fine. That's fine. So there are two ways. One is nowadays no blood sample are drawn without using a gloves. So as long as the person who is drawing the sample is using a sterile gloves properly worn, it's perfectly all right. There's nothing to worry on that. So, okay. Repeating that he must use a disposable sterile gloves to draw the sample and dispose them properly. So that's nothing to worry on that.
Okay. Dr. Chatterjee, can you hear me, sir? All right, I think there's a problem with his line. Do we have another call, another caller? Joseph from Mumbai, go ahead with your question.
My name is Joseph. I have a history of chronic bronchial asthma. Hello, can you hear me?
Yeah, please go ahead with your question.
My name is Joseph.
Yeah,
I have
know.
a
Just
history
ask your
of bronchial
question,
asthma.
Yeah.
And all the related problems that I still have. I'm just worried as to the cough that I have because of my asthma. Are they a matter of concern, and what do I need to do?
Okay, that's a very important question, Dr. Khilnani. This gentleman has bronchial asthma. What are the steps that he needs to do to protect himself?
That's very important. Those people who have bronchial asthma or chronic bronchitis or COPD or congestive cardiac failure, uncontrolled diabetes, those who are more than 60 years old or have chronic kidney disease or liver disease or on chemotherapy for any kind of cancer are at higher risk of adverse outcome with COVID. So if you are taking on corticosteroids for your asthma, that is tablets, then also you are at higher risk. You have to be extra cautious. Now, how you can be extra cautious? That normally we are not advising everybody to use a mask while going here and there. You may consider using a mask for which a 3-layered mask should be sufficient for you. And if there is an increase in symptoms, especially if there is a running nose, there is an increase in your symptoms of asthma despite your usual treatment. And if you develop slightest fever or you feel feverish or if you have body ache which has come new or too much of sneezing, then you should immediately report and go for a diagnostic test.
Okay, Jogeshwar from Hyderabad, go ahead with your question.
Sir, good evening. Actually, this self-curfew or what was that Sunday was basically based on that 12 hours life of this virus. But yesterday, something very authentic information is getting circulated that it is living much more than this 12 hours. And that is my question one. Second question is
Let's just take that first question. Dr. Khilnani, this viewer believes or has read something earlier which said that the virus only lasts 12 hours. How long does it last if it's in contact with the surface?
Yeah, this is extremely important question. The mode of transmission beside droplet infection is the fomites. Fomites are a non-living thing. It could be table or a glass or a pen or newspaper for that matter, the life of a virus on fomites is variable. Like it is found out that on glass it is much less than the paper and so on and so forth, but we believe today that the longest life of a virus is as much as 7 days. So the theory of 12 hours life doesn't hold true, and this Janta curfew was nobody thought that it will completely eliminate the transmission.
Yeah. Dr. Khilnani, a common question that we are asked is, you are allowed to, get food from home delivery services, food delivery services. A lot of them say that, they come in gloves and the food is... So, is it safe to do that? Is it safe to have food deliveries to your own house? Cooked food I'm talking about.
Yeah, that's fine. As far as the gloves are concerned, they are not sacrosanct because gloves, unless you change it with every delivery, I am sure nobody is doing that. So simply because the person is wearing gloves doesn't make it a safe thing, but only thing that box which comes to your house, and that box could be contaminated. There is always a potential that cardboard boxes could be harboring viruses if one of the handlers is suffering from corona. So when you are opening the box, you have to be cautious, and after you have opened the box and transferred your food for eating, you need to clean your hands. That will make it 100% safe for you. Otherwise, you can't be sure about that.
All right. Norma Marshall from Kolkata, go ahead.
Yes, doctor, my name is Norman Marshall. I am 76 years old. I have diabetes, arthritis, gout, and high blood pressure, prostate. Doctor, now...
Yes, go ahead with your question.
I have already taken flu vaccine, pneumonia vaccine, and there's a rumor that this HCQS 200 grams hydrochloroquine is supposed to be good and it helps the immune system. Does it really help?
So that's a very good question because this is a recent information. Today only the Ministry of Health has published guidelines that hydroxychloroquine called HCQS can be given to especially to the healthcare workers who are exposed to the COVID patients or suspected COVID patients. Now, this is based on a very limited study. So, if everybody start taking HCQ, it has several adverse effects also. So, if you are not exposed to any suspected case of COVID, there is no indication for you to take this HCQ. That's what my opinion on this.
And Dr. Khilnani, it's important not to self-medicate on this. If you have a fever or something, you don't just pop these tablets, do you?
Yeah. Sorry?
The danger is that people might see this and just self-medicate on hydrochloroquine, and that's something they mustn't ever do, right?
Absolutely, Vishnu. This is actually happening, and there are reports of serious adverse with chloroquine and hydroxychloroquine when people have taken this indiscriminately. Another thing which has to be understood, that benefit will last as long as you take it. So it is specifically recommended for people who are exposed, I am repeating, who are exposed to suspected or a known coronavirus patient, especially the healthcare workers.
Okay. Sujay Kumar from Chhapra, go ahead. Sujay ji, पूछिए please.
जी पूछ रहे हैं सर कि हम एक रेलवे एम्प्लॉय हैं, ठीक है, और मैं छपरा बिहार से बोल रहा हूँ.
एक चीज कीजिए प्लीज, अपना टीवी को ऑफ कीजिए, फिर वापस कॉल बैक कीजिए. लेट्स ट्राई एंड गेट अजय कुमार अजय ऑन द फोन लाइन फ्रॉम दिल्ली. अजय, गो अहेड. Ajit, go ahead. Ajit, go ahead with your question.
Yeah. My question is, good evening to all of you. My question is, last month I contracted a disease, a viral disease, that is chickenpox. So,
one second, Ajit. I'm sorry, your line is bad. Can you repeat that question once again? If it's, we'll try and answer it. Go ahead. All right, sorry, we can't hear your line. The line is gone. It's very poor. Try to call back and see if you can connect. We'll try and take your call. Hassan from Hyderabad joins us. Hassan, go ahead.
Yeah, hi, good evening. I have a question with the doctor that there is a capsule known as Easy Breath inhalant. So, will it be okay if we can just take this, inhale this capsule to make sure that we are on a safer side? Thank you.
And prevention of COVID, so there's no point in taking it.
Okay, no point in taking that. All right. Who else do we have on the phone line right now? Sujay, go ahead with your questions. पूछिए सुजय जी, बताइए.
सर मैं पूछ रहा हूँ ना कि मैं रेलवे एम्प्लॉय हूँ, ठीक है सर. मैं छपड़ा में पूर्वोत्तर रेलवे बोर्ड में, गोरखपुर बोर्ड में पड़ता है पूर्वोत्तर रेलवे, और बनारस डिवीजन में मैं छपड़ा में जॉब कर रहा हूँ रेलवे में, ठीक है. तो यहाँ पे जो है ना, हेलो,
आप सवाल पूछिए प्लीज.
हाँ, सवाल वही पूछ रहे हैं ना कि हम लोग का यहाँ रेलवे में छुट्टी है या नहीं है.
ओके.
हम लोग को ना ही हम लोग को कुछ प्रोवाइड करा जा रहा है, ना मेडिकल के लिए कुछ प्रोवाइड किया जा रहा है, और ना फिर मास्क, ना फिर.
Okay, would you like to take that? I think it's important, but railway services have been cut down dramatically across the country. I think that's a welcome move. Air travel also has been cut down. Any reply to that? I mean, train travel at this juncture, it's not really happening anymore for the moment.
No, but I cannot answer that question if the masks are not provided or whether they have to attend their duties or not. That's not my area either. I'm not competent to respond to that.
Mushtaq from Srinagar, go ahead with your question.
Sir, I would like to ask you one thing. My mother, she is suffering from multiple myeloma for the last 1 year and a couple of months. She was being treated, and now she is having bi-weekly some therapies, chemotherapies for remission. She's almost under remission. Can we go ahead with this during this time?
Sorry, can you go ahead with what?
She has to take bi-weekly chemo for this. She is suffering from multiple myeloma.
Dr. Khilnani?
Absolutely. Yes, absolutely. You go ahead with the therapy for her. Only thing is that being immunosuppressed because of the disease, that is multiple myeloma, and the chemotherapy, she is severely immunosuppressed, so she should not be exposed to the outside world. That's the advice.
All right, shouldn't be exposed to the outside world. Dr. Khilnani, thanks so much for being with us tonight and taking all those questions from the railways to myeloma and everything in between. Thank you so much indeed, sir.
Thank you. It's always a pleasure to be in touch with you.
All right. We'll take a short break, come back with more. Stay tuned.